Okay, we're live. Welcome, everyone. We're going to get started in just 1 minute. Bienvenidos a todos, a todes. Vamos a empezar en un momentito. As we wait, feel free to introduce your name, your organization, and your pronouns in the chat. Mientras que esperamos, siéntase libre de presentar su nombre, organización y sus pronombres en el chat. Welcome, everyone. Bienvenidos a todos, a todas. We'll be starting in just 1 moment. Vamos a empezar en un momentito. Hi, everyone. Welcome. My name is Elena Josue. I'm from Futures Without Violence. Bienvenidos a todos, a todas. Mi nombre es Elena Josue. Trabajo con Futures Without Violence. Empezamos en un momentito. We're going to start in just 1 minute. Before we begin, we are going to receive some instructions from our interpreters. Antes de empezamos, vamos a recibir algunas instrucciones de nuestros intérpretes. So I will pass it to our interpreters.
Okay. Thank you, Elena. Hi, everyone. My name is Andrea, and I'm here with my co-interpreter, Annabelle. And I'm going to provide you a few set of instructions in both English and Spanish so that you can access language interpretation and you are able to listen to the presentation in the language that you feel the most comfortable. Así que bienvenidos a todos. Mi nombre es Andrea Valencia. Estoy aquí con mi co-intérprete, Annabelle Garay, y les voy a dar una serie de instrucciones para que sepan cómo seleccionar su idioma de preferencia para que puedan escuchar la interpretación, ya sea en inglés o en español, y que puedan escuchar a su gusto. Okay. Primero que nada, ¿cómo activar la interpretación de idiomas en Zoom? Or how to access language interpretation on Zoom. If you're joining today from your computer, please, at this moment, you should be able to find a globe icon at the bottom of your screen. It usually says interpretation. We ask from everyone to select a language channel so that you're just able to hear anything that is in English or Spanish. Así que si se está uniendo desde su computadora, en este momento puede seleccionar y ver el icono de globo terráqueo en la parte inferior de su pantalla que dice interpretación o interpretation. Una vez que esté allí, por favor seleccione su idioma español y si solamente desea escuchar al intérprete, puede silenciar el audio original. Once you click on the globe icon, you should see this language selection. Please select English and make sure to not mute the original audio so that you're still able to hear the main room. Let's go on to the next. If you're joining today through a smart device, either your smartphone or your tablet, please tap lightly on the screen to bring up the 3-dot menu that says more. Once you're there, it should say language interpretation, then select English. Don't forget to tap done in order to activate the selection. Si usted está uniéndose a esta llamada desde un dispositivo inteligente, por favor, encuentre el menú de 3 puntos al tocar ligeramente su pantalla y verá la palabra interpretación o interpretación de idiomas. Después seleccione español y por favor silencie el audio original y termine su selección con listo para activarla. And for everyone here, we ask that you keep your mic muted unless you're speaking. For our presenters, please expand acronyms every time, given that Spanish is 15 to 30% longer and we're not able to condense acronyms in the same way. Another thing is that if you're joining today from a Chromebook or if you're dialing into the session, you will not be able to listen to interpretation. Otros consejos útiles es que por favor no se apresuren al hablar para que el intérprete pueda mantenerse al tanto de lo que se está diciendo, no utilizar acrónimos. silenciar su micrófono y por favor también si está accediendo el día de hoy a través de una computadora Chromebook o si está llamando por teléfono a la sesión, no tendrá acceso a la configuración de interpretación simultánea. Muy bien, muchas gracias. Si tiene alguna pregunta o problema para acceder a la interpretación, puede ponerlo en el chat para que una de nosotras le ayude. And if you have any questions regarding interpretation, please post them in the chat and we'll be able to help you out. Thank you. Y ahora le paso la palabra de vuelta a Elena.
Thank you, Andrea. So welcome everyone to the title of today's webinar is Strategies to Support Farm Workers Experiencing Intimate Partner Violence or Human Trafficking. My name's Elena Josway. I'm filling in for Becca Young from Farmworker Justice, who may be able to join us in a minute. And I'm here with my colleagues at Migrant Clinicians Network and Farmworker Justice, and my colleagues here at Futures from our project Health Partners on IPV and Exploitation. Really happy to have you all here today. And go on to our next slide, thanks. So because domestic violence is so prevalent and because sexual assault is so prevalent, we always assume there are survivors among us. And the content of today will have to do with domestic violence and sexual assault. So we encourage you all to take care of yourself first, step away from the Zoom if you need to. And then a reminder to respect patient and client confidentiality while we're in this webinar here together. Our agenda for today, we will be reviewing the learning objectives for the webinar. We're going to share a little bit about the National Training and Technical Assistance Projects at MCN, Farmworker Justice, and Futures Without Violence. Farmworker Justice will be sharing a bit about a resource that they created on the social determinants of health and a film that they built, Breaking the Silence. Here at Futures at Health Partners on IPV and Exploitation, we will be sharing a bit about our intervention related to universal education that we call CUES, and a new resource that we built that will hopefully also be available to you shortly and that you might use in your work. Migrant Clinicians Network will be sharing some strategies to supporting staff and self-care. And then at the very end, we'll include an evaluation link for each of you to fill out to help us build more trainings in the future. Our learning objectives for today's webinar are to describe 3 tools to improve the delivery of and access to healthcare services for farm workers experiencing intimate partner violence and exploitation, to identify collaboration strategies to address the social determinants of health and improve outcomes for survivors of intimate partner violence in farm worker communities. And then lastly, identify practical tools that community health center staff can implement to build their own resilience and prevent and address vicarious trauma and burnout. Like I mentioned before, I work at Futures Without Violence, and we run a project, a national training and technical assistance program called Health Partners on Intimate Partner Violence and Exploitation. In our project, we're working with community health centers to support those who are at risk of or surviving intimate partner violence, human trafficking, and exploitation, and to bolster efforts towards prevention. If you want to learn more about our training and technical assistance project, the email address is at the bottom of your screen, healthpartnersipve.org, or you can email us at healthpartners@futureswithoutviolence.org. And we're joined by Farmworker Justice. Farmworker Justice is a nonprofit organization that seeks to empower migrant and seasonal farm workers to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. And my colleagues at Farmworker Justice, Nina and Becca, will be sharing more about their program in just a minute. And then lastly, we're also joined by our colleagues at Migrant Clinicians Network, whose mission is to create practical solutions at the intersection of vulnerability, migration, and health. And they envision a world based on health justice and equity, where migration is never an impediment to well-being. And you can learn more about their program and email them at info@migrantclinician.org. And I'm joined by my colleague, Jillian Hopewell from Migrant Clinicians Network, who will be sharing a little bit more about their project later. And with that, I will pass it on to you, Nina, from Farmworker Justice.
Thank you, Elena. So we're going to start today just talking a little bit about social determinants. So social determinants of health are basically the conditions of how people are living and working in their environments. Where you live, what kind of job you do, your place within a community can all be very important predictors of your overall health and well-being. And violence, both in the domestic context as well as at work, is a social determinant of health. For farm workers in the US, there are a number of factors that make them extremely vulnerable to violence of all kinds. I've just listed a few examples on the slide here. So farm workers face barriers accessing safe and affordable housing. Most make low wages, and their immigration status can make it very difficult to get certain benefits or access healthcare services. Many farm workers in the US also have limited English proficiency, which can make it harder to seek out help when they need it. Slide, please. So beyond domestic violence, farm workers are also facing extremely high risk of sexual violence while they're working. It's difficult to find exact numbers on the prevalence of workplace sexual violence among farm workers because these crimes tend to be very underreported, but some studies have found that about 75% to 80% of female farm workers have experienced sexual harassment at work. And we know that sexual harassment can also be a prelude to rape. Sexual harassment and violence can also happen over a long period of time rather than just a single incident. Many farm worker women have reported that their perpetrators have harassed and abused multiple victims. One investigation by the organization Human Rights Watch found that in most cases, the people committing these crimes are foremen, supervisors, company owners, really anyone who has the power to hire and fire workers, as well as confer certain benefits like better hours or permission to take breaks. Co-workers, other farm workers as well, can also be perpetrators and can be enabled in part by an environment that seems tolerant of abuse. Among farm workers, certain workers are also more likely to be victimized. For example, girls, young women, recent immigrants, single women who work alone, and Indigenous workers who often don't speak English or Spanish. And the conditions that enable sexual harassment and rape happen to exist in every industry, but farm workers specifically work with fewer protections than most populations and in conditions that leave them very vulnerable. Farm workers really depend on their employers for a lot, so housing, transportation, income, so it creates a lot of opportunities for exploitation. And most farm workers who push back against abuse or report incidents of sexual violence to management almost always suffer some type of retaliation, whether that's getting fewer hours, being isolated from other workers, being threatened with deportation, or losing their jobs. And because many farm workers work with family members, retaliation can also mean that the victim is fired along with her family, resulting in loss of income to the entire household.
Nina, the interpreters are asking that you slow down just a little bit.
Okay, will do. And farm worker survivors of workplace sexual violence, because they face specific challenges, it's because the agricultural industry has long been treated differently than other industries under US labor law. So the agricultural workers are excluded from many of the basic protections or laws that do exist, and many are not adequately enforced. So in rural communities, there are a few places that farm workers can go to for help, particularly for Indigenous farm workers who speak little Spanish or English, which isolates them even further. And that's why community organizations are so essential to responding to the needs of farm workers. Slide, please. So Farmworker Justice created a training film called Breaking the Silence, which aims to help farm worker organizations reduce sexual harassment and violence in the fields. It was produced by Farmworker Justice in collaboration with Líderes Campesinas, which is a network of women farm worker leaders based in California, who also do work at the national level. And so we're just going to watch the film. It's about 8 minutes. I want to warn everyone that the video contains references and depictions of sexual harassment and violence that can be very distressing to some viewers. So please take care of yourself. So we're going to start the video now. Thank you.
Un día normal en la vida de las campesinas en los cultivos.
A ver, pero va a estar bien caliente. Está bien caliente, doña Adalfe.
María, ven acá.
Ay, ahora que queda el pato. No, ahorita nos miramos, chicas.
Llevan tarde, llevan tarde.
Buenos días, mayor.
Buenos días, mamacita.
Ay, no me esté tocando. No le he dado motivo para que me esté tocando. ¿Ya llegó el agua?
Ay, María, ¿por qué te molestas? Si bien que te gusta que te diga yo así. Además, es muy temprano para pedir agua.
¿Y los baños en dónde están?
No te preocupes, al rato llegan. Ya te puedes ir.
Las campesinas continúan trabajando y más tarde
¡Apúrenle! ¡Muévanse! ¡Échenle ganas, échenle ganas!
Mayor, ya llegó el agua.
No, pero ven acá, aquí tengo agua.
¿Dónde?
Ven,
No, hacerte.
ven.
¿Dónde?
el mayordomo se la lleva medio abrazada
No, déjame
mientras María muestra resistencia.
Pero aquí hay agua.
sola. No me toque.
Mientras tanto, las mujeres que se quedan trabajando hablan de sus cheques de nómina.
Ana, ¿cuántas horas trabajamos la semana pasada?
50 horas. ¿Por qué?
A mí solo me pagaron 45 horas.
Reclámale tus horas.
¿Para qué si de todas maneras no hacen nada?
Mientras tanto, en la troca,
María, ¿no te gustaría acompañarme a una fiesta este fin de semana?
Ya déjeme en paz. Ya le he dicho que tengo esposo. Yo solo quiero trabajar.
el mayordomo intenta abrazarla y ella se resiste y se regresa a trabajar.
Pero ya caerás, chiquita, ya caerás.
El mayordomo ordena que todas se vayan a otro bloque.
¡Apúrenle! ¡Muévanse! María, chiquita, quédate, liviar la traila.
Ella se resiste, pero el mayordomo la toma por la fuerza y la asalta sexualmente.
Déjame en paz. Déjame en paz. Déjame en paz. Ay, mayor, déjame en paz.
Bien que te
Déjame en
gusta.
paz. Déjame en paz.
Bien que te gusta.
Ay, mayor, déjame en paz.
Denos tus secretos. Si dices algo de esto, te echo a la migra. Vete a trabajar ya.
María se encuentra seriamente afectada por lo sucedido. María llora de miedo. Ya de regreso a la labor,
¿Estás bien, María?
Sí.
¿Segura?
No, no tengo nada.
Te veo un poco mal.
No, no tengo nada.
las campesinas continúan trabajando en lo que el mayordomo ordena que tomen su lonche.
Todos agarren break. Agarren quebrada. Corre tiempo.
María, te invito a una reunión de mujeres esta tarde en mi casa.
¿De qué se va a tratar?
Es un foro comunitario donde habrá mucha información sobre los derechos laborales. Por ejemplo, va a haber recursos para trabajadoras del campo y trabajadoras de los restaurantes y trabajadoras de la limpieza.
Déjeme ver, a ver si puedo ir. Yo te aviso.
Bueno, me dejas saber.
Al final de la jornada, el mayordomo se acerca a María y ordena que se quede a limpiar.
Este mayor siempre se quiere pasar de listo con María. No es justo que esto esté pasando. Mañana mismo lo reporto con recursos humanos.
Estoy muy preocupada por María. ¿Ves el mayor cómo la mira y le habla?
No te metas, Ana, no es tu problema. Vete a tu casa ya.
María,
Y las veo más tarde.
¿sí vas a ir a la reunión?
No, no puedo ir. Gracias por invitarme.
¿Sabe qué? Tome este folleto si un día necesitas ayuda. Llame a este número y si necesitas más información, ahí puedes encontrar. Gracias.
Las campesinas fueron invitadas a una reunión comunitaria para conocer sus derechos.
Hoy vamos a hablar sobre los derechos y cómo reportar el abuso, acoso sexual en el trabajo agrícola. ¿Quién quiere empezar?
Yo quiero empezar a hablar sobre los trabajadores agrícolas. No pueden ser despedidos por presentar una queja sobre condiciones de trabajo peligrosas, no sanas o por ejercer sus derechos laborales. Y si alguna de estas siguientes cosas le ha pasado, busque asistencia legal o haga una denuncia con OSHA.
Gracias, Ana. Aquí les comparto otro folleto de información de cómo reportar. El número es 800-669-4000 para la Comisión para la Igualdad, para Oportunidades del Empleo.
I think we can stop it there. Thank you. So this film is part of an initiative that aims to build capacity and educate farm worker community members on how to prevent and address sexual harassment and violence in the workplace. And it can be a useful tool to train outreach workers and promotoras de salud on helping victims of sexual violence. So I hope you all will put your reactions to the video in the chat, but now I want to hand it off to my colleagues at Futures Without Violence. Thank you.
Thanks, Nina. We will, in the next part of the webinar, again, my name is Elena Josue. I work at Health Partners on IPV and Exploitation at Futures Without Violence. And we're going to be sharing a little bit about the work that we're doing here at Health Partners on intimate partner violence and exploitation, and share some resources with you all that hopefully will be useful to you in your work. On the screen, you can see one of the ways that we define success here at Futures. Success is measured by our efforts to reduce isolation and improve options for safety. We think about this quote as our North Star. It's our guide for the resources we build and the solutions that we're imagining. And one of the ways that we're doing this and thinking about success is by building partnerships. And you can go to the next slide. We're thinking about partnerships with healthcare providers, community-based organizations, like the example that Farmworker Justice and Líderes Campesinas built together and exemplified through the video. Thinking about partnerships with survivors, farm worker leaders, domestic violence programs. And we're also thinking about how do you formalize those partnerships between health centers and local domestic violence programs, which we know can be instrumental in supporting survivor health and promoting safety in a coordinated way. So feel free to share in the chat some of the ways that you define success in the partnerships that you have. We know that many partnerships have been born through the pandemic, and that many of you likely in the organizations that you work have been building partnerships with your community-based partners or your community health centers for years long before the pandemic as well. We know that building partnership takes time to get to know each other, takes time to understand the work of your partners better, their needs, their limitations, struggles. And when we're busy putting out fires all the time, why take this time to build partnerships between domestic violence programs and healthcare, community health centers, or community-based organizations? Well, some of the reasons why we think about partnering and why we know partnerships are so important is it can improve outcomes for survivors. We can leverage resources by partnering, including the expertise that already exists in the communities in which our organizations are built, such as the expertise of farm worker leaders and farm worker serving community-based organizations. We know that partnerships also can help support staff too, right? Which we'll hear a little bit more about later on in the presentation through the work that Migrant Clinicians Network is doing around supporting staff. Partnerships can help us address the complexity in the work that we're doing and expand efforts to promote prevention as well. You know, the next slide.
Elena, before you go, I just wanted to comment, Carmen, I see that you have your hand up. I don't know if you have a question, but if you do, please type it into the chat box, and that goes for all of you. If you have any questions as we go along, please type it in the chat box.
Thanks, Jillian. You can go to the next slide. Yeah, so during the pandemic, we saw the benefits of community health center and domestic violence partnerships and what they can do when these partnerships are growing. They worked on issues such as health enrollment for clients and staff, helped survivors establish primary healthcare providers, developed initiatives around COVID testing and vaccinations. We saw so many examples of partnerships working together to distribute COVID masks and home tests, protocol consultations, and support for healthcare center staff. Go to the next slide. One of the ways that Futures is promoting prevention is by thinking about strategies to support survivors in the context of these partnerships and through this idea of universal education. And what is universal education? Universal education is an approach to addressing intimate partner violence and exploitation, and offers support to those who have never experienced intimate partner violence or exploitation, who are currently experiencing intimate partner violence or exploitation, or who may have a history of intimate partner violence and exploitation throughout their lifetime. Provides an opportunity for clients to make a connection between violence, their healthcare, their health problems, and the risk of certain behaviors as well. There are many reasons why someone might not feel comfortable sharing their experience about abuse or exploitation with their healthcare provider or even a community advocate. We might think of some here, they might feel fear or feel shame or any number of reasons why someone might not feel comfortable disclosing that experience. But providing information to all patients about intimate partner violence when you're in the healthcare setting ensures that all survivors receive information about supportive services, about the resources that exist in your community now, or if they or a friend or a relative ever need that support in the future. You can go to the next slide. So many of you may already be familiar with CUES, which is an evidence-based intervention for intimate partner violence. Or maybe you've seen some of the safety cards that are in multiple different languages that we use as part of this intervention. CUES is an acronym that stands for confidentiality, universal education, empowerment, and support. You can go to the next slide. And just to describe what each of those pieces means, Confidentiality means when you meet with patients alone, or always meet with patients alone for part of every visit, when providing that universal education about intimate partner violence, about healthy relationships, share the limits of the confidentiality at the start of that conversation. It's a really critical piece of cues. And then provide universal education, which is information about health and unhealthy relationships, and provide it to all patients, regardless of whether or not they share their own experiences with intimate partner violence. We use a tool that we call a safety card, those multilingual cards that you saw on the previous slide, to help facilitate those conversations and encourage providers to use the card when giving that universal education to the patient. You can open the card, read certain sections that talk about healthy relationships, unhealthy relationships, and where to go to for support, and offer 2 cards to the patient and suggest, in the event that you want that this is an issue for you, or in the event that you want to share this information with a friend or family member, I offer this card to 2 cards to all of my patients. The cues intervention also uses the letter E for empowerment, which is about offering individuals those 2 cards to help them feel more relaxed. 1 card is for them to keep, and 1 card is can be shared with a friend or a relative. And then the last piece of cues is support, which indicates, is a reminder to support survivors if they do disclose violence or abuse, validate what you've heard, and share some kind words or offer a referral to a community-based organization or a domestic violence program, and perhaps even one with which you have built a partnership, so that you have a protocol or a way in which to provide those warm referrals to that community-based organization. The next slide. So these cards, like I mentioned, they're available in a number of different languages. We've adapted the cards for many different communities. They're available to order on the Futures Without Violence National Health Resource Center on Domestic Violence resource page, and the link is in the slide, and we can also paste it into the chat in the event that you want to take a look at these slides and order them for your own healthcare, community health centers, or healthcare settings. And just to mention also that the back of the card includes national telephone numbers that can offer relationship health and other supportive services. Go to the next slide. And we're really excited that we are about to launch a new adaptation of these safety cards that we built in partnership with Alianza Nacional de Campesinas, or the National Farmworker Women's Alliance. We developed the new resource on intimate partner violence and healthcare access. There's also some pieces within the card that touch on things related to COVID-19 healthcare and support. The safety card tool provides information on healthy and unhealthy relationships, the impact of those relationships on our health, and resources for support. Like all of the other safety cards that we have here at Futures, the card is folds up like the size of an accordion into like the size of a business card, you can think of it. And I just want to mention that this card would not exist without the leadership and expertise and experience and advocacy of farm worker leaders from across the United States. During the pandemic, Alianza members provided critical support to farm workers and their families, and really elevated the need for a card that touched on this issue of the intersection between intimate partner violence and health and COVID-19. And from there, this adaptation was born. Over the course of several months, Alianza and health partners on IPV and exploitation, with support from a group of farm worker leaders, developed the tool, and really soon you'll be able to order it on our website. I can share more about that in a minute. You can go to the next slide. Also on the back of the card, there's a blank space that can be used to adapt the card for your local community. So some programs we've heard from are already thinking that perhaps they'll include a sticker on the back of the card that has information about local food bank or housing services, resources that might be really, really local to your own community. Go to the next slide. So how to order the card, you can email, for right now, you can email our program assistant, Camila Sanchez Tejada. Like I mentioned, really soon we'll have an order form up on the website that you'll be able to use to order the card in the future. And we're really excited to be able to share it and hear from folks. Next slide. And then just lastly, I want to share that we also have another website that has information that might be useful to you all in the work that you're doing in your communities at ipvhealthpartners.org. At ipvhealthpartners.org, we also have things like sample memorandums of understanding or sample protocols that might be useful to you as you're formalizing partnerships and promoting those partnerships between domestic violence programs and healthcare providers in your area. It has a lot of information also about promoting prevention. And you can, I see that Camila has already shared the link in the chat, so feel free to take a look at that website as well. And you can find more resources to support the work that you're doing. And with that, I will turn it over to Jillian from Migrant Clinicians Network.
Hey, everybody. And just also by way of background, the information in this webinar it all comes from a learning collaborative that we did. And so our intention was really to have this webinar and really focused on resources that are available to all of you around violence prevention in the agricultural worker population. So there will be a number of links, and so our intent is really to give you some practical tools in all of this. Again, feel free to put in any questions that you have in the chat. Our intent, like I said, is to provide you with resources, and so any information about what you need specifically would be really great. And I do see, Javier, you answered. You want just to clarify, you want information on any health topic that impacts ag workers. And if that's the case, my colleague Theresia can put some links into, there's a number of different organizations and resources. And so there's a lot that we could do to help you out. But what I want to talk about is, so the Migrant Clinicians Network, we do a number of different programs, and we provide support for people who are on the front line of providing services to agricultural workers and other migrant immigrant populations. And one of the major programs that we have is something called Witness to Witness. And the concept here is really looking at support for those people who all of you, people like you, who are providing services on the front line to populations who are really in need and who may be experiencing some really seriously difficult circumstances and have stories that you listen to every day and needs that you attend to every day, and that those things are also challenging for you. And so among the things that we provide are resources to really look at your own well-being as a frontline provider in any capacity, whether that's a clinical provider, such as a physician, or an outreach worker, or community health worker, or anyone else who's working directly with the population. So really want to emphasize this concept that you are witnesses to the suffering and troubles of people that you serve. You're also witness to their joy, but we really do want to acknowledge the fact that it can be very challenging. So witnessing things like violence, people experiencing violence, people who are in fear, can create toxic levels of stress in you. And that it's especially true if you don't find a way to take care of yourself. And I think that, you know, as we talk about some of this a little bit, just to kind of place this in context, if you're, and we're going to talk a little bit about maybe feeling guilty for taking care of yourself and that sort of thing. But I think, you know, one of the things to center in this whole conversation is that you cannot provide services. You cannot support people if you yourself are experiencing stress and anxiety and challenging. So, and those sorts of challenges. So just to, and we have tons of resources on this and very, you know, we could do a whole long series on all of this. So I'm just touching on a couple things, but just to look at when you are in this empathetic stress, the things that you can experience are, you know, you hear about burnout, secondary traumatic stress, vicarious traumatization if it gets really quite severe. So learning how to practice self-care and self-compassion is really critical to being able to not only be healthy yourself, but also provide services to the people that you care about. There are several national studies that on average find that only about 15% of healthcare workers, and that's healthcare workers along the spectrum of different kinds of, you know, whether that's a medical assistant or an outreach worker or a nurse or a physician, that only about 15% engage in self-care activities more than 4 days a week. And I think that it can be very difficult for people who have the sort of helping orientation, people who work in where your career is really focused on helping people. And there's a number of different things that people can tell themselves. I know I personally have been guilty of a number of these things, but you know, that I help people and I don't ask for help, that maybe people may think less of you if you ask for help. And so I think this can be a challenging thing for many people. And if this resonates with you, I'd love to know in the chat if you've heard anything else like this. Some of the things that our constituents have told us through some of our activities is that being vulnerable is not my strong suit. It's very challenging. I'm embarrassed. I've been let down when I've asked for help before. I'm trying to be strong for others, or I know I shouldn't be this upset or feel this way. And I just want to emphasize that self-care is not selfish. It's how we take care of our collective well-being. So collectively, it's not just about you, but it's about the people around you, your family, and the people that you're trying to serve. We have a number of different resources, and Tharisha has shared a link in the chat, but you know, just some things to think about. I'm just leaving you with a couple things today that maybe you can walk away with that would help you. But these are some things to say to yourself, things like, I am doing enough. Letting someone know how affected I am can help me. I'm not going to read all of them. You have this, and the next slide provides it to you in Spanish. But some of these things may resonate with you, and some of them may not. But it's a very helpful thing to kind of, it's like that self-talk, giving yours, and it sometimes takes practice. The same thing with gratitude. Finding gratitude in very challenging situations can often shift your perspective. So expressing appreciation to the people around you. For some people, it helps to write down something for which you're grateful every day. Or you could do that in the morning or right before you go to bed. Sometimes expressing appreciation to a stranger is incredibly powerful. It's such a simple thing, but it really can have a powerful impact. And then just some strategies, quick ways to feel better right away if you're really experiencing some immediate stress. My husband works with children who've been identified as emotionally disturbed, and he uses a number of these things with them, but they can be very helpful for us as adults too, to, you know, just jump in place, give a hug, laugh, write down things you're grateful for, just notice something beautiful. Some of those very small things can have a really big impact. And I'm not trying to minimize it. This is not to say that the things you're experiencing aren't really big and very challenging, but some of these sort of simple strategies can help you in kind of the immediate self-care. This is just shows we have a number of different resources. We also developed a number of self-care resources related to the COVID pandemic. And there's a whole series of these, and that's at the link that Theresia shared. And I'll just leave with this thought that you know, the small is not trivial, and the actions that we take have ripple effects outward. So the kindness that you share, or the beauty that you notice, can truly ripple outwards, both for yourself and for your community. And so I just want to recognize again that as you do this very difficult work, that it is really very important for you to take care of yourself, which in turn takes care of everyone around you. I'll go back for a second here, but sort of on this thought, want to know if any of you have any questions. If you want to put this is an opportunity really for you to let us know what you need, and for us to find resources that can support you. So, oh, Isabel, thank you so much for that. Unfair to put the burden of self-care on individuals, absolutely. And the role of organizations and systems is really critical. We have a series of learning collaboratives on that topic specifically, and about working with organizations so that they better support their staff, both, and not just sort of like, I'm going to slap on a yoga program and assume that people are going to be fine, but really looking at the systemic issues that cause people to disengage or to not have power within the system, which then in turn contributes to a great deal of stress and anxiety. And definitely increased funding for violence intervention and prevention agencies for the living wage, absolutely critical. And the overload of the work is really also a very important point. What else do you all what else do you need? You know, what other sorts of information would be really helpful for you? And any of my colleagues on the panel, I know that my colleague Becca, who had some technical issues coming in. I don't know, Becca, if you have anything that you want to add to what has been said so far.
Thanks, Jillian. No, I mean, I think that this is, you know, great information. I was able to, you know, kind of lurk in the background and hear the part on our presentation too. You know, I guess I think that it's an interesting time, because we are sort of, in some ways we're heading out of the pandemic, but in other ways we're still completely embedded within the pandemic. And so I think that some of those issues around stress and self-care, particularly now, are actually more important than ever, because there's not really a unified front in how we're all feeling about where we're at in terms of COVID specifically. So I think that this information about self-care is actually more critical than ever. So anyway, your presentation was just making me reflect a bit on that.
I also wanted to ask Nina and Becca about resources that you have through your work with Líderes Campesinas. The video is so powerful. And are there other resources that accompany the video that people can use?
Yeah, and you're welcome to visit our website. I did put that information in there. We have a short fotonovela that accompanies that topic. And then, so that's sort of the package. We also have a video discussion guide if it's something that you want to use more broadly within your communities or even your own organization. I'll also include my email there so that you can reach out to me personally if you're interested, and I can send you those material.
And I know that Alexis put into the chat that the story told during the video, the story told in the video was a true story. And I wonder if you could sort of comment on that.
Yeah, I can elaborate on that a bit too. So it was actually a really incredible experience to get to go and not just film the video with Líderes Campesinas, but to go through the process of creating the script. I think what was so inspiring about it is that the stories were actually drawn from the community members themselves. Those were experiences that that some of the women had specifically gone through, and in other ways were kind of a melding of different stories that had come together. Because of that, at the filming itself, it was a very intense experience and a really emotional experience for so many. Because, and I think for those of you that have experienced any kind of partner violence, or in this case, violence in the field, can understand, it really reawakens all of those images and trauma and experiences that folks have gone through. And so I remember from the filming, there were various times that the action just sort of had to stop, and people would kind of gather together and process that, or just sometimes even step away into their own space to be able to process those emotions. And some of the actors had gone through those experiences. And so I don't want to say that it was unexpected, that it came, but I think for those actors in particular, they didn't realize quite how alive those feelings really were. So it was a really personal video, but also I think a video that resonated with so many that are out there, because it told the story really of so many.
Yeah, it was very powerful, and it is. There are parts of it that are very difficult to watch. I think it's very important that we give witness to what people experience. Elena, I wanted to ask you about the cues card. If people do you also provide technical assistance to people who are interested in implementing a program within the cues card? Is meant to be used primarily between a provider and again, any like it could be a community health worker, it could be a physician, but between a provider and their patient, right?
Yeah, that's right. The cards themselves are meant to help facilitate those conversations and to be used within the context of what is the cues intervention. On our website, which I will ask my colleague Camila to enter into the chat, at Health Partners on IPV and Exploitation, we have a number of trainings that delve even deeper into the cues intervention and go through each of those steps in the intervention: confidentiality, universal education, and empowerment and support. We have sample scripts on the website for providers to use to facilitate those conversations. We also have several videos as well that I believe are up on that site that are sort of reenactments of how that conversation between a provider and a patient might happen while using the card. And then the last thing I'll share is that on the Health Resources Center website, there's a number of different cards that have been adapted for a number of different communities. I think there's something like over 40. We just encourage the participants today to take a look at the Resource Center website and look at the cards, and feel free to order them for your community health centers or your healthcare providers as well.
I also think the concept of universal education is one that I don't know everybody fully understands. I'm wondering if you could just elaborate on that for a minute.
Yeah, the idea behind universal education is to provide information about intimate partner violence and exploitation, healthy relationships, unhealthy relationships to all patients, regardless of whether or not that patient has disclosed that that has been an experience of theirs. The idea is that you're providing information to anyone, and that even if they do not disclose that that has been an experience, for survivors that perhaps are still in need of support, that they're receiving that information about resources in the community. And while some folks do decide to disclose with their healthcare provider those experiences, then the idea is that through the card, through resources, through partnerships, through protocols in your health center, that providers are able to respond with support to validate those experiences and to provide useful resources to folks in the community. And so that's what we think of when we think of universal education. You know, I think that while it is, we're talking about the context of healthcare providers and health and community health centers in this webinar, it's also true that this idea of universal education is perhaps something that those of you out there who are outreach workers, who are working in the space of prevention, who are domestic violence advocates might also be familiar with, because it is perhaps the way that you go about doing your work. Is how can we get messages out there about intimate partner violence, about healthy relationships, about unhealthy relationships, about the resources that are out there to support you all as your community as well. So while we're talking about it in the context of a community health center, we're talking about it in the context of what healthcare providers can do and share with their patients. I think that this concept perhaps might also resonate with those of you who are working in the community, who are doing outreach, who are doing work related to prevention, and who are working with survivors. And I see my colleague Anna also has shared more information about cues, including our infographic and those additional safety card tools. And
I think also the sample policies and the scripts and other things that you all have could be really, really helpful for people. So yeah, I definitely encourage everyone to explore all the resources that you have. Well, we are about at time then. We really appreciate you all being here with us today. We hope that we've provided you with some resources. I see there's one more. Oh, can we put the link to this survey in the chat? I think Camila did that. And, you know, we encourage any of you to reach out to us and we'll, you know, be happy to do follow-up, any follow-up questions you have or any other types of resources that you're interested in. We are available to you, and this is our job. We're happy to help you. And we want to thank all of you for being with us.
Thank you all.